Hi YouTube. I'm making another surgery video. This one was kind of inspired by conversations in Facebook groups and a video that I watched that was really good about this particular topic. But one aspect that's one of the first things you'll encounter in planning a surgery in the Dominican Republic is rumors everywhere. And some of the worst ones are spread by American surgeons, which is not to say American surgeons are not good or that they're trying deliberately to mislead you or anything bad. It's just that I've seen some of the most pervasive rumors come from surgeons in the United States and then get repeated in Facebook groups. So I'll go into rumors first. There are some other things I want to talk about too, and they kind of all tie into each other. So one of the most commonly discussed things in all the groups, in your surgeons group, in the main groups for all the surgeons, is that there are no pain medications in the Dominican Republic, there are fake medications in the Dominican Republic, or you only get ibuprofen after your surgery. And I have a theory that a lot of this is due to the fact that people in certain facilities may not get great overnight care. So the first night when the pain may be the most acute, they're not, excuse me, sorry, they're not getting care in a timely fashion. So they are coming away with the impression that there are no drugs in the Dominican Republic that, that we might use here. One of the Dominican doctors, Dr. Sesto, answered a question on Real Self about this, and he made a very good point. A lot of the medications and therapies in the Dominican Republic are not approved in the United States, or they're used in Europe, which a lot of people are less scared of Europe than they are of the Dominican Republic. But some of the drugs have different names there than they do here and are the same. So from my research, because I'm nervous about this too, like you are, it looks like they use Oxaforte, which seems to get good reviews outside the context of surgery. That's Oxaforte, 2 words. And Ultram, which is Tramadol, which has mixed reviews. Some people say it does work, some people say it doesn't work, some people say it depends on how often you use pain relievers. If you're not, a chronic pain patient, it might work for you. So the no drugs or fake drugs thing, I mean, there may be counterfeit drugs, pharmacies, who knows? I don't know. I haven't seen any credible reports of it. So I just wanted to alleviate any concerns other people had, or at least give them a starting point for research. So that's something that I found out so far. Another thing that was in one of the groups briefly, but the thread was closed and it caused a furor. And as one other doll pointed out very sagely, there was absolutely no truth that it was true, or proof that it was true. But the claim was that 11 people died during plastic surgery this year in the Dominican Republic. That's completely unsubstantiated. Nobody was able to turn up any sort of information suggesting that that might be true. Excuse me, sorry. It looked like somebody had counted up all the news reports of any death anywhere in the world and attributed them all to the Dominican Republic. So I thought it was important that, people not come away repeating or believing that rumor. It doesn't seem like that's true. And if so, these are not like on the record cases that we were able to look up. Just a side note, a lot of people keep saying surgery in a third world country. The Dominican Republic is a developing country, not a third world country. We don't use that terminology anymore. Not that it's politically correct or not, it's just inaccurate. The United States is a developed nation, but just roughly and broadly, the United States, for some reason, happens to be at the very bottom of developed countries in terms of healthcare. We have terrible outcomes where they're not expected. Maternal mortality, infant mortality are a lot lower, or higher, sorry, than you would expect in a developed country. So, in terms of, a lot of this has to do with relative safety and balance, and that's something that, you should really be aware of. So, the last statistics I could find in terms of overall health ranking, the United States is ranked 37. The Dominican Republic is ranked 51. We're both a few spots away from each other, but when you adjust for the sizes of the countries and pockets of poor care, the difference you know, statistically may not be as bad as you think it is, or as people might tell you it is. And this is why it's important to do research, ask people, and ask your surgeon, which is another thing we'll get to soon. Drains. A lot of people are afraid to travel with drains. I see a lot of dolls make posts like, I don't want to go home with my drains, nobody will take them out for me, blah, blah, blah. You can actually, may not be recommended, I'm not sure, I'm not a doctor, but you may be able to take out your own drains very easily as long as you use a sterile environment and sterile supplies. So, you know, that's really a thing that I think gets overhyped in terms of traveling, is the drain issue. I know some people have hyped up drainless tummy tucks and other surgeries, but it's my understanding that the body continues to produce lymph and other fluids in order to help heal areas that have been operated on. So if you need the drains, I would not hesitate to travel home with them if you're still draining fluid on the day that you go home, because if you rush taking them out, I'm not sure if it's more of a chance, but you know, their early drain removal, I believe, is correlated with seroma development. Nobody wants to deal with that. So, I mean, you know, you'll probably be okay, but it's just a hassle, it's expensive, nobody wants to deal with that. Another thing that kind of goes back to medication is that in the Dominican Republic they use off-brand medications or off-brand implants. And most pharmaceutical manufacturers are worldwide. Some of the ones where you get your medications every day are not based in the United States. So a lot of the drugs that you see, like I said in an earlier video, the infamous blue pill is midazolam, and in the United States it's called Versed, and you may have already taken it for sedation dentistry, and in the Dominican Republic it's called Dormicum. I'm not sure if I'm saying that right, but the other one I mentioned, Tramadol, I'm not sure what it's called there, but here it's called Ultram. It's very common. It's a narcotic pain reliever. So again, these are not off-brand, they're just different names. But somebody might see something on a prescription or a bottle and get nervous because it looks unfamiliar. I know a rumor I saw floating around on Real Self is XYZ doctor uses off-brand Chinese implants, like he ordered them from Wish.com or something. Not the case. So just a little bit of background, and this is off the top of my head. You can fact check me if you want. For a long time in the United States, silicone implants were banned over fears that were resolved that they had complications. So there was a long period of time where they were only used off-label for people because they are known to be better in terms, on most metrics, than saline implants. Some people feel uncomfortable with foreign bodies in their body. But, you know, silicone, the new silicone implants are great because they're cohesive gel, so they don't leak. They just kind of are a solid. So in the Dominican Republic, I know my surgeon uses Eurosilicone, which is what they use in Europe. It's not used here because it's not this, you know, they never use saline in the Dominican Republic, I believe. I don't think anybody used it really outside the United States because it's a poorer product. So, it's not off-brand, it's just a brand that you find more in Europe, and that's the case with a lot of medications in the Dominican Republic. Another thing I've seen surgeons say is that if you fly, you're at a really high risk of embolism. And that would be true for flying inside the United States for the same duration as well. From what I understand, the risk of embolism is very low if you take precautions, and maybe even if you don't. We know that a lot of women travel for surgery, and we're not really seeing a ton of news reports about women dying of embolisms, getting off of planes, on planes, whatever. So I wouldn't let that one scare you too much in terms of, you know, take precautions, be smart, do what your doctor tells you, look up deep vein thrombosis and how to avoid it, and do those things. But that's another thing I've seen used to scare people, and I think it's a little bit silly because it's a known quantity. We know about embolisms and what causes them and how frequent they are, and they're also frequent with birth control pills, so that's a thing. And I also wanted to get... Sorry, something just fell. I wanted to get into, briefly, which seems totally unrelated now, but they felt related in my mind, what you need to pack. I'm going to do a packing video when I have everything with me. But my surgical coordinator, like I said in an earlier video, Janet, she said don't overpack. So I imagine that she sees a lot of overpacking and not a lot of, you know, people packing exactly what they need. So, sorry, this is a little bright. So she told me to bring maternity pads, which are medical grade maxi pads. I never understood why these were always on packing lists, but apparently it has to do with padding incisions before you put on a faja. So, you know, if you don't use maxi pads for their intended purpose, that's what they're on packing lists for. I see she recommended, most people recommend that you bring maxi dresses. She said 3. Now, most recovery houses will do your laundry, so it's something to bear in mind when you're going on vacation. You need to bring enough clothes for the whole time, but if you have 3 maxi dresses, that's enough, I think, if you're going to have laundry done for you on a daily or every other day basis. Men's undershirts, commonly called wife beaters, are on almost every packing list. I'm not sure specifically why people say to bring them, but I'm going to bring a few. I think it's for right after surgery when you're not really wearing clothes, but you don't want to be around like naked all the time, so there is that. A lot of people recommend what's known as a female urinal, and I think that's because you may be using the bathroom a lot, and you may not want to be standing and sitting up and standing and sitting up and all those things. And you also might not want to sit if you're getting a BBL. So I did get one of those from Amazon. It was like $5, not too bad. I personally decided to get a BBL pillow just because it seems it's more frequently recommended that you use them than not. But we'll get more into whether or not to use them in a minute. And how long. So, also, you need a tourist card, which you can get at the airport, but you can also print yours off online, which I did. It's in my passport folder. So, I would do that if you can, if it's an option, if you have access to a printer. It's just one less thing you have to think about. If you're bringing your own medication, you know, bring that, but also bear in mind, make sure to check in with your surgeon about what you may already have been medicated with, what's been an IV, any of those things, because you don't want to mix medications. That's far more dangerous than a lot of other things that people worry about. You know, mixing narcotic medications and benzodiazepine, all those things. They're just check and make sure it's safe for you to take them, that your doctor knows what the equivalent is there, and all those things. Ab boards and lipo foam. I've seen a lot of dolls not recommend the foam. A lot of them swear by the ab boards. I'm probably not going to get the foam because it sounds annoying. Now, I've read, and this is a rumor, not to wear it on the plane. So you might want to ask your surgeon about that. You might want to ask the airline about it, you know, if you're already getting into the kind of habit of how you wear your faja. And then the other important thing is compression socks. So I got these. I was very excited about them. Because I wanted something to look at when I was going to surgery that reminded me to be in a good mood. I got some other white ones too, but this is for surgery and maybe for the plane ride home. But they're on Amazon. They were like $15, and then I got some multi-packs of the white ones. Your recovery house and surgeon will probably give you some too, but these are one of the more important things in surgical safety and traveling is compression. So there's that. And as I mentioned in the beginning, I watched a video from another surgery vlogger who said that, you know, this person asked me, ask your surgeon. And as soon as I settled on Dr. Lima, overnight I came up with like 20 questions that I had to have answered. So I sent them over WhatsApp to Janet, and she answered, she pretty much answered them. Like, a lot of them might not have had answers or whatever. I can't remember the conversation. WhatsApp won't open on my computer anymore. It's very buggy, so I only have it on my phone. But there are certain things, like I mentioned, with the drains and the BBL pillow and all those things. The answers and the regimens and the recommendations vary so wildly from surgeon to surgeon. Some surgeons in the Dominican Republic don't recommend using a BBL pillow. Some recommend using a boppy. Some recommend using a BBL pillow for 2 months. So This may have to do with your surgeon's technique. It may have to do with the way the surgery is done. So that's a question to definitely ask your surgeon, even if you are kind of putting your feelers out online for experiences. But I did choose to buy one because if you're spending money on surgery, you might as well spend an extra $60 or $80 to to protect it. And I sit a lot for my job, and I'm going to be doing my job while I'm there, hopefully, unless I'm like severely in pain. And I also mentioned drains. It's another thing you can ask your doctor about, and pain medications. Don't be afraid to ask your surgeon what the pain protocol is. They're probably used to that question. They're probably, you know, they might even know the American equivalents. But for the most part, any of these questions, you can directly ask your surgeon. They may be hard to get a hold of. I know my surgeon is not hard to get a hold of. He's happy to hear from you anytime you contact him. So, and so is Janet. Janet will also reply to me in the Facebook groups. You know, if I make a question, or if I post a question or make a comment that indicates I don't know something. So, you know, it really depends on your surgeon and their remote bedside matter, but that's a really important thing to me, and that's the thing I think a lot of people don't consider. But yeah, so the main thing that I really wanted to drive home was don't believe everything you read online. A lot of these comments are coming from women who have just come out of surgery. Some people have said that some of the anesthetics can make you hallucinate, so they may not be reliable stories. I'm not sure if that's true or not, but, you know, just take everything you read with a grain of salt. And I think that goes more for negative reviews than positive ones. If somebody's giving a positive experience, chances are they haven't been, you know, distorted into believing a positive thing happened to them. That's kind of a strange thing. So, you know, it's just really important to weight what you read and make sure that, you know, you're seeing multiple, reports or multiple people saying something before you start to really take it seriously. Like with my doctor, one thing that really makes me happy and makes me feel safe, because I'm a big crybaby, and I know people say if you're a crybaby, don't get the surgery. I'm getting the surgery, so I'm a big crybaby. I have a big fear of medical situations because my first C-section was a little traumatic. I don't want to go into it and make this a really long video, but it was like 17 hours of like people telling me something was just going to be like a stick, and then it was like excruciating pain. So, and that happened over and over and over to me. So by the time the anesthesiologist came in, he said he's going to put an epidural on my back, and I said, "Is it going to hurt?" And he said, "Yes." And I started to like shake and cry. And then he said, "The more you cry, the more it's going to hurt." And I started to cry harder. And I think that was probably my first panic attack, which I do have panic attacks. It sucks, but it's true. I can't remember why I was talking about that, but it had to do with, oh, yeah, I have a medical phobia. I don't like to be in this, when I smell hospitals and the crunchy blue stuff just kind of brings me right back there. And it's not the worst trauma in the world, but it's very real for me to be scared there. So, you know, the girls, the dolls in my groups who have seen Dr. Lima all report, you know, being comfortable. Some say the massages are not entirely comfortable, but for the most part, everybody is happy, and that really, that means a lot to me, because I've seen reports from some of the really popular doctors, you know, of just girls or dolls being left overnight, you know, the facility not being up to par, poor pain management, and I think that if I was going in with that as my, you know, my guideline for what to expect, I would not be as comfortable as I am. So, this is kind of an all over the place video, but I'll link in the comments to anything that I mentioned that you might want to buy, and if you have any questions or if you want me to address something in any follow-up videos, please let me know, and thank you for watching.